Dr. AYSHA FAHEEMA. You are from?
Comtrust Hospital. Good morning all. I'm AYSHA FAHEEMA from Comtrust Eye Hospital. I'm here to present my research work titled A Prospective Study of Visual Outcome and Patient Tolerance of Scleral Contact Lenses. So coming to the introduction, scleral contact lenses they vault over the entire corneal surface and they rest on the sclera. The unique feature of scleral contact lens is that they have a precorneal liquid reservoir, which neutralizes the irregular astigmatism and confers a moist environment to the cornea, thus protecting from exposure to air and from the friction of blinking. The Scleral Lens Education Society classified scleral contact lenses into 3 types based on the diameter to semi-scleral, ranging diameter from 12.5 to 15 mm, mini-scleral lenses with diameter 15 to 18 mm, and large scleral lenses with diameter 18 to 25 mm. So the main indication for the use of scleral contact lenses are broadly divided into 2 categories: for vision improvement in cases of primary corneal ectasias like keratoconus, keratoglobus, and pellucid margin degenerations, and secondary ectasias where there is post-refractive surgery and corneal irregularities due to injury or corneal ulcers or corneal suture scars. And the next main indication is corneal protection in cases of Stevens-Johnson syndrome, ocular cicatricial pemphigoid, etc. So the main aim and coming to the aim and objective of the study, main aim is to assess the visual outcome and patient comfort with scleral contact lenses. The objective of the study was to study the effect of scleral contact lens on vision, to study the patient comfort and acceptance of scleral contact lenses, to determine the indications of scleral contact lenses. Study design. It was a longitudinal observational study conducted at Comtrust Eye Hospital, Calicut. 24 eyes of patients fitted with scleral contact lenses were enrolled into the study. The study was carried out during the time period from January 2021 to December 2021. The inclusion criteria of the study was all patients who were prescribed with scleral contact lenses between the age group of 15 to 60 years, those patients with bullous keratopathy, conjunctival bleb, any systemic illness which prevents the contact lens wear like mental retardation, Parkinson's disease, or in conditions where IOP is not controlled were excluded from the study. Methodology. First, a detailed history and evaluation of the patient is done, including the anterior segment examination and posterior segment examination. The IOP is also recorded. The vision is recorded, both the uncorrected visual acuity and best corrected visual acuity was recorded with a Snellen star, and it was later converted into log mark. Also, the near vision was also recorded. Then scleral lens trial was done on these patients, in which we assessed the fit of the lens, both the central and the peripheral fit, and the vision with scleral lenses was recorded. And patient was given a questionnaire which is based on modified NEA, National Eye Institute Visual Function Questionnaire 25 questionnaire, which assessed the subjective evaluation of the patient, subjective difficulties of the patient without any correction or with the impaired vision. Next is customized scleral lenses ordered, and the patients were followed up after a period of 3 months, in which we record the vision with scleral contact lenses, the number of hours per day the patient is wearing the scleral contact lens, any complications with the use of scleral contact lens, and the subjective analysis is rechecked with the use of scleral contact lens. Coming to the results and discussion, we found that the main indication of scleral contact lens was in keratoconus patients. Almost 75% of the patients who had prescribed scleral contact lens were keratoconus patients post C3R, and 16.7% of the patients had advanced keratoconus, and 4.2% of the patients had central corneal scar, and 4.2% was post-penetrating keratoplasty. This was found in agreement with the study by Pulam et al., which showed the major indication for scleral contact lens was keratoconus or other primary corneal ectasias, followed by corneal transplant in 18.6%, followed by ocular surface discomfort in 11.4% of the patient. Also, Weiser et al. Study also showed that the major indication for Scleral contact lens use was keratoconus followed by post-penetrating keratoplasty, and other indications were irregular astigmatism due to scars, keratitis, trauma and irradiation. Now the visual outcome, we found that the baseline visual outcome of visual acuity of these patients in logMAR was 1.04 plus or minus 0.53, and this improved to a value of 0.27 plus or minus 0.21 at the 3 months with the use of scleral contact lens, and this showed this was statistically significant. The results were in agreement with the study by Preeti et al., which showed an improvement of vision from logMAR 0.59 plus or minus 0.32 to improvement with scleral contact lens to a value of 0.24 plus or minus 0.19, and Low et al. Also showed an improvement of BCVA in logMAR from 0.71 plus or minus 0.5 to 0.05 to plus or minus 0.07. The study also showed that there is improvement of the near vision to N6 from the baseline value of less than N36 in majority of the patient. The subjective analysis was done in 4 domains: social function, role difficulties, dependency, and mental health. The social function value showed an improvement from the baseline value of 16.04 plus or minus 2.53 to a value of 7.92 plus or minus 1.53 with the use of scleral contact lens at the end of 3 months. The role difficulty domain also showed an improvement from the baseline score of 4 to a baseline to the score of 2 at the end of 3 months. The dependency domain also showed an improvement from value of 2 to a value of 1 in majority of the cases, and the mental health domain also showed an improvement of value from the score of 2 to score of 1 in 95.8% cases. This was in accordance with the study by Preeti et al. And AYSHA et al. And Abou-Samara et al., which showed then a significant degree of comfort with the use of scleral contact lens. The duration of use was found to be 6 to 7 hours per day in majority of the cases, followed by 8 to 9 hours per day in 25% of the cases. And none of the patients reported any infectious complication, while 87.5% did not report any complication. 8.3% of the patients reported occasional dryness, and 4.2% had complaints of occasional itching. And this was in the study by Abou-Samara showed complications like allergies, tight lens syndrome, dry eye syndrome, broken lenses, and lens scratches, SPKs with the use of scleral contact lens. So in order to conclude, the scleral contact lens provide optical correction in patients with irregular corneas due to various conditions like corneal ectasia, post-penetrating keratoplasty, corneal scars due to trauma or other infections. Significant improvement of both vision and quality of life of the patients was noted. Patients should be reviewed to look for any complications related to the scleral contact lens use. A steep learning curve is required for the self-installation of scleral contact lenses. Thank you.
And we have exceeded the time also. So you are supposed to have finished within 6 minutes. Okay, but you were told about something scar, no? In scar, how the vision can, which you told central scar.
Yes.
So scleral contact, what for you have applied scleral contact lens?
The scleral contact lens, they minimize the light scattering due to the presence of precorneal liquid reservoir between the lens, and the patient had improvement of vision, though not up to 6.6 and N6. Patient
Suppose I am having a leukoma in front of the pupillary area, it's a central area. We have applied scleral contact. Will it improve?
No, we have to at least a pupillar, some part of the pupil should be spared with a
because you have
scar.
told generally central scar.
Yes.
You have not mentioned whether it is covering the pupil or away.
Yes.
Okay. Thank you.
Okay. Again, I wanted to ask that same question. What was the indication of using that scleral contact lens in a central corneal opacity? You said specifically it is a central corneal opacity. Was there any improvement of vision in that case?
Yeah, the patient had central corneal opacity. The patient had scar due to trauma and following the surgery, and the patient had improvement up to 636. Though the near vision was not improved, the near vision was less than N36.
So maybe some part of the pupillary area was clear.
Some part of the pupil should be spared.
Okay. What was the diameter of the lens used in all cases? Same diameter or different?
In most of the cases, we ordered the semi-scleral lenses, but when the fitting is not correct for the patient, we have to move for the lens with have more